breast fat transfer. That's what we're talking about today. I'm Dr. Paul Zalzo.
I'm Dr. Brad Weening. Welcome to Talking with Docs. We have a special guest, Dr. Roger Short, plastic surgeon.
Well, thank you. Thank you for
Welcome
having
back,
me.
Roger.
And we're talking about transplanting fat today, taking fat from one part of your body and putting it in another part of your body. Pretty fascinating stuff, I'd say.
Yeah, it's something that's been going on for quite a while, but it's really getting a lot more popular more recently. Probably since the late 80s, it's been done regularly.
Oh, wow. Since the late 80s, we've been doing it, but now it's gaining popularity more recently.
Yeah, I think a lot of people are trying to avoid implants, and I think it provides them an opportunity to get fuller breasts without an implant.
Okay, tell us what it is. What is this breast fat transfer?
So it's liposuction. It's liposuction of fat from an area you don't want it and putting it in a place where you do want it.
Okay.
Common spots would be the side of the thighs, the tummy, the flanks, the love handles.
So those are your donor sites. That's where
Those are
you're
the
getting
donor
from.
sites.
Okay.
Those are the spots people often have fat they don't want.
Okay.
So we take it there, we put it in the breast, and it can be win-win.
All right. So it's done in one sitting, one procedure?
It's a bit variable. Each procedure you can get your breast about 50-60% fuller. So we'll go up to about double in the size of the breast.
Oh, wow.
But you're going to lose some of that volume over the first week, first month. So what you're left with is about 50 or 60% improvement overall. But you can do it as long as you have fat, you can do the procedure as many times as you want.
Okay, finally, Talking with Docs is telling you a use for your fat. Instead of us trying to tell you all the time to get rid of it, now we're telling you how you can use it.
And so there's two separate phases, right? So there's the liposuction phase and then the implantation phase. So the liposuction, can you tell us a little bit about how that actually works? So someone comes to the office, has a consultation, obviously a thoughtful consideration about this whole process, and then you guys come to a collective decision to go ahead. And then what does it look like for the patient actually getting through the process?
Yeah, so on the day of surgery, I essentially ask them where do they have fat they don't want.
Okay.
There's not really any preferential site for fat. Ideally, you want to have a good amount of volume. And ideally, the end result from where we're doing liposuction is going to be an improved contour, not just the breast fullness.
Right, and we'd want to be symmetric too, obviously. If it was from the sides of your hips, you'd want it from both sides. And so how much fat are we talking about? So what's the maximum amount that you could take out with liposuction? Is there a limit?
There are probably limits, but I don't think we come anywhere close to it in this procedure. In this procedure, the limits are really, do you have enough fat and do you have enough place to put it?
So usually the answer, I'm assuming, for the first one is yes. Most people have fat, even thin people.
Everybody thinks they have fat.
Oh.
There's certainly lots of people who come to the consultations and I say, okay, great, show us your fat. And they're like, it's everywhere. And you look and you really have to take a little bit from everywhere. So you take a little bit from
Maybe they have one of those mirrors at home, you know, the concave ones. Yeah, try a flat mirror.
So
okay, so you've got donor sites that the patient will identify and say, this is where I want to take the fat from. And then you take that fat, just a regular liposuction procedure, which has been done for decades.
And so wait, so just so I don't really know. So you freeze it, and then you put a small device that goes in and essentially like vacuums it out, or how does it work?
Yeah, so patients are typically asleep for this.
Okay.
We put fluid in that minimizes postoperative pain and minimizes any bleeding.
Okay.
And it's a liposuction cannula that's hooked up into a canister, so it collects it all sterilely.
Okay.
We'll collect as much as we think we need, and then some extras, so we don't have to go back just in case. And I've never heard anybody complain about taking out extra fat.
Sure, and sterility is important because, especially for this, because we're putting it back in.
We're putting it back in.
Okay.
We decant it in some warmed Ringer's lactate for about 20 minutes, and then we transfer it into syringes, and then we just inject it carefully into the breast.
Okay.
How many injections typically do you go into the breast?
Well, because you want each fat cell to be close to viable tissue, you're really passing a small cannula with, either 5 cc up to maybe a 20 cc syringe hundreds of times.
Oh, wow. Okay.
And this is obviously a very small gauge needle, I'm assuming.
Small gauge, yeah.
Right? And then, so you're saying that when we put this fat in, it wants to live. Like we can't just put it in there and let it die.
Correct.
That's why it has to be so many different locations, because we want to grow.
I think of it like filling a sponge with fat. Like you don't want to just bolus one giant spot.
Right.
You want to intertwine it with all the other tissue.
Right. Okay. And so how long would it take? Obviously, it depends, but
it's typically about 2.5 to 3 hours.
Ooh, that's a long
On
procedure.
somebody who's really small, it's hard to find the fat,
Right.
but you don't have to put as much in. Because
Right.
they typically have smaller breasts.
Right.
On somebody who's heavier, the fat comes out easier, but it takes longer to put the fat in because there's more volume to go in. So it works out about the same.
Okay. And You can't take fat from one person into another person.
That's a great question.
No, I get offers for that many times a
Really?
day. Yeah.
Really?
Take some extra and then you can give it to my
yeah,
friend.
Yeah,
exactly.
sell my
Yeah.
fat. But that doesn't
Not
happen.
yet.
That's not a
No.
thing. Not yet.
No.
Maybe down the road. Not
Maybe
yet.
down the road.
Okay, so 3-hour procedure. They wake up in the recovery room, spend a couple hours with you, make sure they've had no adverse reactions, that kind of stuff, and then go
Correct.
home.
Yep.
Does it hurt? Sorry. Does
Okay,
this
great
hurt?
question.
It's bruising. It's like if you get a Charlie horse, you know, if you're just standing there, it doesn't hurt. But if somebody asks you, hey, does that hurt when I press? Like it'll feel tender.
Okay.
I usually tell people that they won't notice it too much during the day, but probably trying to get a comfortable sleeping position is going to prove challenging.
And that's so it's mostly donor site pain as opposed to recipient site pain.
It's bruising.
Donor site
Sometimes it can be
discomfort.
quite a bit of bruising, but yeah, it's
Because
really
when
a
we
bruising
take
pain.
bone graft,
Oof.
we take bone graft from
Yeah,
the,
it's
from
nothing
the
like
pelvis. That really hurts.
Yeah.
Yeah, it's nothing
Okay,
like
so
that.
not that bad if you've had that done. All right, and so then recovery. How long does it take to recover from something
So
like
you wear compression. Anytime we do liposuction, you have a compression garment, and you usually wake up with that. You're going to wear that for about 6 weeks. Obviously, you take it off for showering and changing it and washing, but more or less 6 weeks of compression. For the breasts, it's really just wearing a bra for comfort.
Okay.
We don't want compression there where the fat cells are. There's certain activities I don't want people doing, like running or jumping on a trampoline. Like I kind of want that fat cell
Stay
to
where
get
it
new
is.
blood vessels, and
Right.
they're going to be delicate and fragile at first. So at first, I just want them, you know, walking is fine, light exercise, leg lunges or squats would be okay, but not much more than that.
And so the recovery, like you said, is new blood vessels or angiogenesis. Blood vessels are going to this fat to keep it the same size, or will that fat have the potential to grow just like other fat cells in our body?
Yeah, the fat works the same way it does anywhere
So if your,
else.
as your weight
So
goes up, it will go
your
up.
weight
as
goes
your-
up, breasts get bigger, weight goes down. So I
Okay.
usually tell people that they should be at a standard, like a stable weight going into surgery. Like
Okay.
anybody who comes in artificially heavy, the procedure might work, but they're just going to
Oh.
see that their breasts get smaller after. So a stable weight
Right.
is important.
Okay.
And these fat cells, this adipose tissue revascularizes and it remains living tissue inside your body. So this is basically in lieu of an implant or something artificial in your body,
Correct.
right? Natural born fillers,
Yeah.
like the movie.
Nice.
Yeah.
So this is a completely natural end result.
Yep.
It's basically your body, still your body in a different part of your body, as opposed to
Exactly.
collagen injections or other injections and things like that.
Yeah.
Okay, so anything people have to watch out for after in terms of screening, breast cancer, that kind of stuff.
Yeah, so one of the things I talk about with patients regarding fat transfer to the breast is if you overdo it, you can have some fat necrosis.
Okay.
Even if you're really cautious, you can still have cysts in the breast.
Okay.
These show up on mammograms and ultrasounds fairly clearly. But what I tell patients is that when they're talking to the person who's filling out their requisition,
Yeah.
just to indicate that they've had breast surgery. I think the radiologist, if they see a finding on an imaging report or on an image that looks a bit atypical, as long as they know where it came from,
Right.
they say that's fine. I think if they don't have that information, it probably increases the number of biopsies somebody might be recommended for otherwise benign breast findings.
Would there be any preoperative screening to make sure that, say, they didn't have an existing breast cancer before you did a procedure like this?
Yeah, I think anytime you do breast surgery, you should consider whether a mammogram would be warranted.
Okay.
I think it's going to be based on age, based on family history,
risk
personal
factors.
history, risk factors
course.
for patients.
Okay.
Okay, and now success rate. This works 100% of the time, every time looks perfect, or is there a success rate associated with it where
Yeah,
occasionally things don't go as planned?
well, I would say that the success rate, everybody gets some benefit. Whether they get as much benefit as they're hoping for is not guaranteed.
Expectations.
So, as I said earlier, like, 50, 60% increase in size is pretty realistic. I think if patients go into it thinking they're going to keep 100% of their fat, or if they think they're going to go into it and have the same result they could with a large implant, they're going to come out disappointed. So I think choosing patients appropriately, spending a lot of time informing patients about realistic expectations is important for getting happy patients.
Same for joint replacement surgery, to be honest with you. Like
Right.
and we say, listen, the surgery typically goes well, but if you can't do X and you thought you were going to be able to, then you're disappointed. We're like, well, we never thought you were going to be able to do that anyway. So you have to have that conversation
Yeah,
before.
you have to be upfront with them.
Sure.
Managing
So
expectations.
at what point after surgery would you say, okay, here's what you have is what you're going to get? Like, where do they reach that steady state where you've recovered, essentially?
Yeah, I think probably at 3 months is
Yep.
a pretty good estimate. Perhaps sooner. Like I take pictures of people at a week, at a month, at
Yep.
3 months, and And then I don't really have a great reason to have them back other than if they show up, years later for something different, then I'll get pictures. But really, I don't see a lot of difference between the 1 month and the 3 month pictures.
Okay.
Okay, so plateaus after about a month. So you were mentioning that initially they might look larger because they're swollen, and then
Yeah.
as the swelling comes down, post-operative swelling, which happens with almost every surgery, as the swelling comes down, then they sort of plateau to the new size.
Yeah,
they're
and
gonna
any
be.
cells that don't survive the process, get resorbed at that point. So 3 months is probably a fairly safe
Okay.
estimate.
Now, you mentioned some of the complications that can happen, fat necrosis, cysts, anything else, infection, has that ever happened?
Infection would be really uncommon. Bruising is quite common.
Sure.
And some people obviously bruise more than others, as you know. And bruising, mostly that's happening in the donor site.
Right.
Because we use
Okay.
a much larger cannula to harvest fat than we do to put it in, so we typically see more bruising there.
Okay, so like any procedure, there's risks associated. However, with this procedure, the risks are very small. And like we always say, when you have a foreign material in, the risk of infection goes up. So implants, I would imagine, have a higher chance of infection or something like that happening. But because this is natural tissue, living tissue, the chance of an infection is so low.
Yeah, it's definitely not the same risk as when we're using implants. And the other, I guess, benefit when we're comparing to implants is implants don't last forever.
Right.
At some point, people do need to have them checked. Usually the recommendation is at 5 years, and then every 3 years after that, either an ultrasound or MRI.
Yep.
Whereas with fat grafting, you have it and that's good.
Okay.
You don't need a
I
check.
got 2 more questions.
Yeah.
One, can you do it again? So say a year later, you're like, you know what? I'd maybe like to contour a little bit differently or be a little
Yeah.
bigger. Can you do it again?
Yep, absolutely. Some people come in with that in mind, like they're going to
Right,
do it
like a
more than
staged
once.
kind of
and
procedure.
some people decide after they've had it once they want to do it again.
And then number 2, we talked a little bit about this before we started. Can you put the fat elsewhere?
Sure, you can, fat grafting is used for all kinds of things.
Yeah.
You put it in the face for rejuvenation,
Right, so like in your cheeks, your
back
lips,
of hands,
or
labia, or lips, all kinds of places.
Yeah, buttocks,
Butt,
very
butt's a very
common.
popular one.
yeah. Okay.
There's many uses for that fat that you don't want.
Yeah.
Okay, well, now you know. This is a topic that came up in a couple of comments. People had asked for us to discuss this topic, and now we brought in the professional to talk all about it. If you like this video, please like it. Subscribe to our channel. Share it with someone that you think this would be beneficial for.
And we'll put Dr. Short's contact in the description if you want to ask more about it. Or please do leave comments. And remember, you are in charge of your own health. Now you're in charge of where your fat goes.
There you go. We'll see you next time. Thanks, Dr. Short.
Thanks, guys. Thanks.